Hi, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and today I'd like to talk to you about peripheral neuropathy. So if you suffer from peripheral neuropathy, if you have any of these signs of peripheral neuropathy, which is numbness in the feet, burning in the feet, cramping in your feet, sharp electrical pain in your feet or in your hands, not just in your feet, also in your hands, pain when you walk, difficulty sleeping from leg discomfort, prickling or tingling feelings in your feet, loss of balance, falling, because when you have neuropathy, that affects the nerves in your feet, and the nerves in your feet can control your balance and coordinated movement. If you have weakness in your legs, if you have swelling in your legs, and you've been told there's nothing you can do about it. If you have peripheral neuropathy, most likely you've been to your medical doctor, you may have been to a neurologist, you may have had testing done, and they probably have told you there's nothing you can do about it, it's going to get worse, learn to live with it, take these medications, take Neurontin, take Lyrica, take gabapentin, and you're going to have to take it the rest of your life. What you're going to find out is gabapentin, Neurontin, and Lyrica, they're really not so good for your brain. We're going to talk about that. It affects the way your brain functions. So let's talk a little bit more about neuropathy. So again, let's talk about the neuropathy and neuropathy medications, Neurontin, Lyrica, gabapentin. The most important thing you need to understand with these drugs is they don't affect the peripheral nerves. What they do is they cover the neuropathy symptoms. They affect your brain. So the messages from your nerves, and this is like a really large nerve. This is what a nerve looks like. A nerve is very similar to an electrical wire covered with insulation. The insulation is known as the myelin sheath. So this nerve needs to function well. But with neuropathy, what happens is this myelin sheath starts to get thin and worn down because of all types of different issues. And these messages that are coming through peripherally, what I mean by peripheral, peripheral means not the spinal cord and not the brain. That is central nervous system. Peripheral nervous system are all your nerves. The messages from your nerves go up through these wires, right? And they come up through the nerve, which is basically like an electrical cord, up into the brain. Okay, and then the messages from the brain send messages down through the nerves and control the muscles and things like that. So when this thing starts to die off, when the covering, when the insulation starts to die off, which is called peripheral neuropathy, you start to affect these different areas or these different nerves, which can cause burning pain, can cause numbness, can cause weakness, all the things we talked about. Neurontin doesn't actually affect the peripheral nerve. It controls, or it actually works by affecting your brain. It shuts down the firing in your brain. So the messages, the painful messages, have got to get up the peripheral nerve, up the spinal cord to your brain for you to perceive them. So what gabapentin and Neurontin and these things do is they shut down the way your brain fires. But it can't just affect the pain nerves, it has to also affect the whole brain. And this is why these things are not good to take long term. Look at all the symptoms. Look at all the side effects of gabapentin. Just Google it. Don't take my word for it. Read what you're taking. So it's not a very good medication to take. Studies have shown Neurontin and Lyrica are highly toxic to you developing new brain synapses. If you don't develop new brain synapses, you are developing problems. Okay, so it's essential that we teach you that. Okay, so again, the Neurontin, the Lyrica, the gabapentin is not helping your peripheral nerves, it's affecting your brain. Okay? So how are we different? So our approach is to rebuild and restore your peripheral nerves. We want to improve your nerve and your brain function using proven nutritional protocols as well as specific nerve stimulations and therapies. So what we do in our office is we improve your peripheral nerve functioning by stimulating those nerves and decreasing the inflammation. So what causes neuropathy? We're going to find that underlying cause. We want to find out why you have the neuropathy. The reason why you have the neuropathy is not because you're missing gabapentin, Lyrica, or all these different drugs. There is a reason, and there's usually a neurological reason, a metabolic, or a structural reason. And so we're going to look for these things. One of the couple big things, and if you click on this post, you can learn more about what we do. But here's a couple big ones: high blood sugars. High blood sugars damage nerves. Food sensitivities. Food sensitivities will also create inflammation in the body. High inflammation will damage nerves. People that take a lot of cholesterol medication, statins shut down the synthesis of the cholesterol. And this is why we see so many people these days with peripheral neuropathy because we have so many people on statin medications. Another cause for it is problems with your lower back, degenerative joint disease, where your lower back, the discs in your lower back are degenerating, and so then the nerves that are coming off of your spine are degenerating. So we look for that cause as well. So we're going to look at everything. Another cause is people that have had chemotherapy. But people with chemotherapy-based neuropathies can also be helped with the different neurological stimulations and the different types of care that we do in our office. So to learn more, click on this Facebook post. So the biggest thing you need to understand is our office utilizes the most recent and rehabilitative therapies and cutting-edge and innovative options to stimulate and improve your nerve function. So what we do here flat out works. We help people with neuropathy. If you click on this post, you'll see multiple testimonials of people we've helped. We help people every single day. So let's go back to what we started in the beginning before we started this video. How many people have been told that you can't do anything for your neuropathy? It's just not true. We help them all the time. But we need to find out how bad your neuropathy is. We need to do a neuropathy severity rating to find out exactly how far along your neuropathy is. There are some people that have such bad neuropathy that we can't get better. But for the most part, we can help 85 to 90% of the people that walk into our office if they get here soon enough. So what I would recommend you do is click on this Facebook post, and you'll see that we have an offer for you. You'll be able to try out our care. For $47, we have a new patient special where you get an exam, neuropathy exam, where we'll actually score your neuropathy. We will do any necessary x-rays. We will look at any blood work that we think is pertinent to your problem. And the great thing about it is you get to try our care. You get to do 2 free care sessions included in the $47. This is like a $300 value for the examination, all the testing, and the 2 free care sessions. So if you're interested in that, click on this Facebook post. It'll take you to our Chester County Neuropathy Relief website. You can learn more there, and you can also call our office if you'd like to take advantage of that offer. Okay? Thank you very much for listening.